actually more members have indicated that they'd like to put questions to the Minister of Health in reference to her statement. Minister, the first member who would like to put a question to you is the Leader of the Opposition. Honorable Member, you have the floor.
Thank you, Mr. Speaker. I'd like to concur with the sentiments of the Health Minister that we certainly, concerning COVID-19, need not panic, but we need to lay in place plans and to inform one another on a daily basis and remind one another on a daily basis of the necessary new changes that we need to make in our lifestyle as we go forward concerning COVID-19. The question I have is, I'd asked a question before when the honorable member gave a statement of when did we start testing at the airport. Now we're hearing also that there is a nurse that is doing an assessment. I'd like to know when had that started? Unfortunately, we're still hearing reports that some people are not being asked pertinent questions. So it'd be good to let the public know that these risk assessments are being done and when it started. And in addition to that, with the assessment, what is the risk assessment that they are doing at the hospital? Is it just a questionnaire, or are we taking people's temperatures? And the reason I say that, Mr. Speaker, asking that question, just to qualify the question, is most people don't want to travel because they're afraid of being quarantined wherever they go. And so it's least likely that some people will say, well, I'm feeling like my temperature's up. At a minimum, we should be taking, I believe, their temperature at the borderline. So that's my question.
Okay. Minister?
Thank you, Mr. Speaker, and I thank the honorable member for that question. I'm afraid I don't have the exact date, but it has been several weeks when the exact questioning, and it's not testing by the customs officers. I'll explain that process in a moment. When a traveler enters in Bermuda, their first point of contact is with the customs. The customs will go through a series of questions such as where have you traveled from, ascertain if they've traveled from a at-risk country, look at the traveler to see whether or not they appear to have any type of illnesses, such as fever or so forth. There is an on-call community health worker that's also situate at the airport. If, upon the observations of the customs officer, as well as the passenger has identified that they have come from one of the high-risk countries, I don't have the names in front of me, but it's all within the public purview, excuse me. If the answer to those are yes, then that person goes to see the nurse. If there are observations, as I've indicated, about fever and so forth, is a special room, a quarantine room, so to speak, at the airport. The nurse takes that person back there and continues another series of questions with respect to assuring, ascertaining the risk. And there's a health questionnaire that is completed, and it speaks about where have they traveled in the last 14 days, such as the countries. They do a temperature check. They ask whether there's coughing, shortness of breath. I'm reading the questionnaire that the nurse goes through for the risk assessment. They ask them, insofar as whilst they were traveling, what were they doing? In other words, have they been around symptoms of COVID? Have they gone to places that had COVID, i.e. working within facilities such as hospital settings, et cetera, et cetera? All that information is collected, and the nurse does a full assessment. If, Mr. Speaker, upon the conclusion of that, and they've gathered all that information and so forth, then the nurse's assessment is such that the person needs to receive medical treatment, then the fire service, which are the first responders, are contacted. They are called in advance to the hospital, of course, like we've said. The person is transmitted to the hospital. However, insofar as the questioning, Mr. Speaker, there is a questioning that's done by the frontline customs officers, as I said, that speaks to where have they traveled. They will make observations about the person insofar as whether they appear to have flu-like symptoms, sweating, et cetera, and then send them to a secondary assessment, which is done by the community health nurses. I'll see if I can get that question. It's been several weeks that they've been doing these, this particular process, the protocols in place.
Supplementary?
I guess it's more of a clarification on the question that I asked and the answer I'm looking for. There was two different answers. When did we start questioning at the border, and when was the nurse put in place at the actual airport itself that is backing up? So if I could get the answers to that. I know she doesn't have them right offhand, but if we could get that answer. Supplementary, Mr. Speaker, considering that, as I mentioned, taking people are a bit leery about being quarantined as they visit the island. I was wondering if the honorable member would at least entertain at least doing a temperature test on all incoming folk. Prevention is far better than having to come behind. And if we can screen as much as possible as we look around the world, we can see that they are taking the temperatures of everyone coming through the borders. These temperature type guns are very simple. They just, they don't touch you. They just scan your body temperature very quickly. 2 seconds and it's done.
Sure.
If the honorable member would consider that as being the next phase that she should be moving into, that I think would be great.
Minister?
Yes, thank you. And I thank the member for that question. Mr. Speaker, I can say that the Ministry of Health is exploring all avenues as it relates to prevention, and including in that particular area and avenue, so to speak, is the issue and the investigation of the temperature systems, whether or not it's the handheld one or one that you walk through. There has been, we are exploring all that. In fact, we have a meeting tomorrow with a potential vendor and have also sourced vendors that can provide that particular mechanism. Which mechanism is utilized, I can't speak to at this point, but we are in the process currently of actively looking at a particular thermal scanner and acquiring such a scanner for our ports of entry. So that is actually an active pursuit.
Thank you. Any supplementary?
Second question.
Well, I think one of your members wants a supplementary, right? Supplementary?
Yeah, supplementary. Good morning, Mr. Speaker. Just following off what the minister's response was, according to having somebody who is actually showing symptoms and going through the questionnaire and then potentially having to be taken to the hospital for further testing. What would happen if that person was showing those symptoms on the aircraft? What about the people that were sitting next to that person? So obviously, if that person is sneezing and coughing, and it seems that a lot of the way of spreading it is going to be with droplets. So the potential of the people around that person, that's the area. So what would happen in that particular situation once the questionnaire has happened? How are we going to deal with the people that were in close proximity to that person?
Minister?
Thank you, and I thank the honorable member for that question. Mr. Speaker, what happens to the passenger on the plane? Obviously, there's no, we as a jurisdiction can't control what Delta Airlines does if a passenger is exhibiting symptoms. I do understand, though, from our conversations with the airlines that they generally will try to isolate the patient by virtue of providing them with masks so that they're not, they're isolated in that regard. They can't take them off the plane, obviously, or isolate them on the plane, but they're providing them with a mask. We are all aware of a recent publicized event that occurred in Bermuda recently concerning a similar episode that the honorable member is speaking about. And at the time, the Red Cross, as I said, we're working with our business partners and our community partners, and the Red Cross assisted by providing a helpline for passengers to ask questions if they were concerned. Probably, I guess, within 48 hours, I can't remember, it was shortly after that particular episode, we did then provide a public announcement to the public to indicate that this individual did not have COVID-19. However, insofar as passengers that may be concerned, when they come through to the airport, we're asking them to just, of course, express their concerns to the health officers that are there, and that to watch themselves. And if they notice that within the next couple of days that they are exhibiting any types of the symptoms that I've spoken about, to call ahead to their healthcare professional and indicate that they may have had exposure by virtue of flying on a plane where somebody was coughing and sneezing. I do also want to remember and remind colleagues that it is flu season. So oftentimes the persons that may be in your vicinity that are coughing and sneezing may have influenza as opposed to COVID. However, again, we're inviting members of the public if they feel that they may have had an exposure, such as on a plane, and they notice symptoms. So it's not to just call and say, I was on a plane and the person sitting next to me was sneezing, but if you notice that you have elevated temperature or you're having any type of respiratory challenges, then we are suggesting that you call ahead to your medical facility and indicate, I was traveling last week, I was sitting next to a passenger that was sneezing, I have some concerns because I have some symptoms, and therefore you will get advice from the medical personnel insofar as what next steps.
Thank you, Minister. Supplementary?
Yeah, supplementary. So the issue is that once that person has been taken to the hospital and they're going through the testing and there's a 5-day period waiting for the test to come back, the other people that potentially were exposed to it have gone home and potentially taken that to their elderly parents. The issue really is, we talk about that 80% of the population are really going to see mild symptoms, but Bermuda has an aging population with people that do have underlying issues. So really, the real fear that I think the population is going to have is that you've taken that home to your aging parents, and you might not know for 5 days that you were actually exposed, and then 14 days later that you actually are one of the people that is carrying it. So if the minister, I understand that the people in that area are going to be told, as it was in that instance, maybe, the following day or 48 hours later, that somebody has been taken to the hospital for this, but we really won't know whether they actually have COVID-19 for another 5 days if they've been tested. So the question is, how are we actually going to deal with step 1 to step 2 to step 3? I understand that we've taken care of step 1, the potential if the person is showing the symptoms, but if you are in that vicinity of that person and you're saying that it might have been the flu, you've gone home and you haven't paid attention to it. How are we dealing with the impact that we can have in a country this size very quickly if we're getting this from one person coming in with COVID-19?
Thank you, Mr. Speaker. If I understand the question correctly, and I probably don't, if
I make
the
it through
persons
if
that
I
are
make
on
it
the
through
plane,
airport,
I beg your
what happens? My interpretation, if I make it through the airport process, what happens when I get home and I realize I have it? That's basically what you're asking?
you'll probably, if you get home and you realize you have it, well, first, you won't know if you have it unless you've had a test. Secondly, you will have symptoms. So if you're experiencing any type of symptoms, respiratory symptoms, elevated fever, coughing, and sneezing, then you're symptomatic. When you have a symptom, then we are suggesting to persons to contact their doctors in advance and indicate to their doctors that they may have been exposed. I have to also say, Mr. Speaker, is that on a scenario of a plane like we spoke about, the other passengers that are on the plane will be contacted. It's called contact tracing. And they will be contacted by members of the community health nurses to indicate, to remind them, we want you to make sure that you check your temperature, self-assess whether or not you have any of those types of symptoms, et cetera. So the contact tracing will take place. So that, let's say there was 60 passengers on the plane. One person was exhibiting these type of symptoms that we're all speaking about. The other 59 people will be contacted by public health nurses and will be given instructions such as check your temperature, watch out for signs, watch out for symptoms, et cetera. If you have those, don't go to the doctor directly. Call ahead and say, I may have been exposed. These are my symptoms that I've observed for the last 24 hours. I was on a plane 2 days ago, et cetera, et cetera. So those persons will be contacted by public health nurses to be provided with the information and the instructions accordingly.
Thank you. Opposition Leader, you want to go to your second question now? Oh, you supplementary over his question? Okay, supplementary.
Good morning, Mr. Speaker.
Good morning.
Would the honorable member please just confirm or deny that the testing that has been done on people who have exhibited severe symptoms that could potentially be COVID-19, that the tests that have been provided so far actually even cover the COVID-19, or are they simple influenza tests?
The tests that we have been doing on the 8 patients, the 8 persons is a test for COVID-19. The test is done, the specimen is taken and the test is currently being done by CARFA in Trinidad, the Caribbean Public Health Organization. Yes.
Yeah.
Whether or not those patients have also been tested for influenza, I believe they have, but they certainly have been tested for the COVID-18. 8 persons, excuse me, Mr. Speaker, have been tested. 3 have come back negative, and we're waiting for the results of the others.
Okay. Supplementary?
I have a supplementary. yes.
Supplementary?
My first supplementary is, what is the timeline expected between sending the samples off for testing and receiving the results back? Because presumably the samples themselves have to physically be taken to Trinidad, and then the results can come back by
Minister?
email or whatever.
Yes, actually, they're not taking physically to Trinidad. They're doing it all by FedEx and so forth. It takes 4 to 5 days from the moment that sample is taken to the receipt of the receipt of the results, excuse me, between 4 and 5 days. Can I just add?
Sure.
Again, notwithstanding that it would take between 4 and 5 days, we are currently exploring, as I indicated in the ministerial statement, Mr. Speaker, with our international partners as well as locally, the availability to test here on island. However, if a person is being tested for COVID-19 because they are obviously exhibiting symptoms, the advice from the community health nurse would still be, and still is, to self-monitor and remain in quarantine. So if we're sending a test overseas and it's going to take 4 or 5 days for that test to result, you're still in quarantine anyway, because that's the advice, and you'll be monitored by the healthcare professionals. Once we have the ability once commercially available tests are made available, and Bermuda is actively resourcing that as we speak, we will be able to then test here in Bermuda. However, notwithstanding that we're testing locally, that patient is still advised to remain in quarantine.
Thank you. Supplementary?
Yes, thank you, Mr. Speaker. I'm just referring to just slightly earlier within this section of the minister's response in terms of thermal monitors. How far away are we from actually obtaining them? I know the minister indicated that they were exploring it. I'm just curious how far away a decision or an availability is likely to be had, because we are now, almost 2 months into this epidemic, and I think to be exploring seems like we are probably just, into the situation. It would appear that we could have been a little bit more proactive as opposed to being just exploring now. I'm just wondering how far away are the receipt of the thermal monitors?
Thank you.
Thank you. I
Minister?
thank the honorable member for that question. And as I've indicated previously, this is a time for us to all come together to try to address this issue. And by making false claims, particularly making a claim that this particular issue is an epidemic, is part of the scaremongering that we're trying to
Point of
avoid.
order, Mr. Speaker.
However, Mr. Speaker,
Point of
the
order,
answer
Mr.
to the
Speaker.
question.
We'll take your point of order.
Yes, I think it's important that, I misspoke and I immediately corrected the misstatement. So I think that it's important, as opposed to being, I immediately corrected the misstatement.
Mr. Speaker, with
said
respect to the
situation
question concerning
rather
the
than
thermal monitoring, as I've indicated, that is being explored. We have another meeting with a local provider tomorrow. It's been the person that's in charge addressing all the procurement of the items that we need in Bermuda, such as the PPEs, the masks, and so forth, are also in the process of procuring the thermal monitors. I cannot speak with certainty whether or not it's going to be a handheld or one that you walk under the walk through, but they are looking at that as we speak, and they are procuring those. Which type it's going to be, I don't know, but it will be some mechanism for monitoring the temperature of persons arriving into Bermuda at all ports.
Thank you. Opposition Leader, would you like to put your second question now?
I have a bunch of questions. Second question, you mentioned the hand sanitizer shipment coming in, and I was just curious, exactly who is that shipment for? Is it for civil service or who is this hand sanitizer for?
Mr. Speaker, the hand sanitizers I mentioned previously, I think in one of the other earlier statements, will be distributed A, to the public, B, to persons like nursing homes and so forth, as well as to civil servants. We're in the process of, it's actually en route. I believe it's going to land any day now, but it is en route, and it's going to be made available to the public. There are other companies that we've also been in discussion with that are also going to be bringing in further supplies that are required. But these ones that we're bringing in from the government are going to be obviously distributed free of charge. I'm not saying that that's not going to be the case with the other industry partners that are bringing in hand sanitizer, but it's just going to be distributed for whoever needs some.
Thank you. Supplementary? No supplementary. Third question? No more? We move on, Minister, to the next member who wants to ask a question. The member from constituency 22, MP Pearman, would you like to put your question?
Thank you, Mr. Speaker, and thanks to the Honorable and Learned Minister for her very helpful statement today. What we've understand you to say is that there are no confirmed cases in Bermuda at present, that there have been 8 tested, 3 tested, proved negative, and 5 are pending. And most importantly, Minister, what I've heard you to say is not to panic and the importance of isolation in the case of symptoms and hand washing. My question is back to test kits. Your indication is that at the moment, the testing being carried out in Bermuda, as I've understood you, is that they're currently being sent to the Caribbean Public Health Organization, and within 4 or 5 days, people are having a response. My question concerns your statement at page 10, where you say, I would like to currently reiterate that currently there are no commercially available, scientifically valid tests that can provide instant results in the world. I was just looking at the CDC website, which does seem to suggest that there are, in fact, real-time swab kits. And my understanding, and let me stress it's my understanding, I may have misheard, but I thought that the House was told on Friday that test kits had been ordered and would be arriving on the island on Tuesday. Again, let me stress that is my recollection. If I'm wrong about that, I'll stand corrected. But could you just clarify what test kits were being ordered, if they were being ordered, and whether these test kits are different from real-time swab kits? And Minister, the reason I'm asking is that knowledge is power, and that unknown causes fear. So clarification would be most welcome on this point.
Thank you. I
Minister?
thank that honorable member and honorable and learned member for his question. Just 2 things real quickly, Mr. Speaker. There was a question previously asked about whether COVID, whether the persons that have been tested, and 8 in total, like I said, have been tested. 3 have come back negative. All 8 were tested for both COVID-19 and influenza. Secondly, and I don't want to make light of this. However, Mr. Speaker, when it comes to the testing, when we indicate, when they say a rapid test, I think what persons have to understand, and I'm not trying to make light, it's not a pregnancy test. So they're not doing something and then you wait 30 minutes and you see if it's a blue or a pink line. The rapid test still requires validation. So you can't do a swab and then, so rapid is relative. What they do have, because it takes 2 days to analyze the results. They've got to, and I'm not a scientist. I'm a lawyer, but I am not a scientist. But it takes 2 days for them to actually do the sample, run it, and to make sure that they have a valid result. So the testing would never have represented last week, Tuesday. And the honorable member did say he may be mistaken. If I did, that was incorrect. And maybe I would not have misspoke. Because we knew we wouldn't have them, because the Public Health England is who we've been dealing with, and we're trying to still make sure that we can get a commercially available test. However, when I say rapid, let's be real, it is not a pregnancy test where you're going to receive the results in 30 minutes, because it takes 2 days to analyze it. 2 important features that I have to emphasize. Whilst it's being analyzed and whilst the test has been sent overseas currently, like I said, we will be getting it in Bermuda, you're still in quarantine. So you're in quarantine whether or not it's going to CARFA in Trinidad to be analyzed, or whether we're analyzing it down the road in Bermuda, which is the intent. And again, we have been sourcing test kits that can work with the actual products that are on island, the machines, the PCRs and the equalizers and all those things that are on island so that we can get the test here. There are, in the United Kingdom, it's a particular microbiology system service. They have 60 in all of the United Kingdom for a population of 65 million. So we are looking to get this, but I want to make sure that honorable members recognize that when they say rapid, it's not like swab and test. You're not like sometimes where the doctor's office have a test and you can look at it, and if it turns blue or green, then you can say if it's positive or negative. Because what we do not want is to be looking at tests that are not validated and a person has a false positive or a false negative. So we have to do this right. We recognize that people want to know. When you see what's going on, you see it like, for example, there's somebody sent me a note of, I think it was in China, and they were like, oh, they're testing 10,000 people a day, da, 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 da. It takes 3 days to get the results. So yeah, it takes 10 minutes to do an inside swab, but they still have to wait for the test results. So as soon as they are available, I would expect to be in a position in the next, certainly by this time next week at the latest, to be able to indicate to honorable members and the public, this is the status. I'm expecting that is imminently. I don't want to speak out of school because I'm waiting for the contract, but we are on the cusp of being able to, we've negotiated it and we're on the cusp of going ahead and ordering it and pushing the trigger to get the test here. But in the meantime, I do want to reemphasize, so forgive me, Mr. Speaker, for sounding repetitious. If a person has the symptoms and is going to be tested, whether it's going to take 5 days to send it to CARFA or 2 days to be tested down on Queen Street, the reality is you're still going to be quarantined and you're still going to be checked by a health officer.
Thank you.
Supplementary.
Supplementary?
I thank you for the minister's answer. And indeed, my colleague has just mentioned to me that the reference to Tuesday may have in fact been from the Premier, not from the minister. So anyway, I was working from memory. I would refer the minister to the CDC website, which does seem to suggest, and I've just read the passage, I can certainly pass it to the minister, that there are real-time swab tests. I'll leave it there because the important point, I think, is the minister's answer. This is my question. So did I understand the minister to say that it is the government's intention to try to have on-island testing? And when will that decision be taken?
Thank you, Mr. Speaker. Mr. Speaker, I thank the honorable member for his question. I am supported by a very, very talented team that are committed to this particular process. This is not their first rodeo, so to speak. They were the same team, the epidemiology and surveillance team were around for Ebola and SARS and the host of other transmittable diseases that have been coming through. So we are very familiar with what is out there. I'm not suggesting for a moment that the honorable member, I know the honorable member would have seen a rapid test, but I just need colleagues to understand. It's when they say rapid, the swab takes probably 2 seconds to swab your nasal passage or your inside of your throat. But the results, in order to get the results, so it is rapid, the test is rapid, but the results are not, because they have to do the analysis, and the analysis of that 2-second swab takes approximately 2 days. So I just want to make sure that, because this is a very good question, because people want to know that, and they see on TV people getting swabbed and they think that the swab is going to give them an immediate result. It will not, because the analysis itself is going to require 2 days. It is not a pregnancy test. It's going to take 2 days, Mr. Speaker, for the analysis. And insofar as the government has committed to getting the test mechanisms as well as the actual test on island so that we can test locally as opposed to sending to CARFA, I may be in a position by the end of the day to be able to update members, because literally as soon as we're done here, I'm going back to the ministry to find out the status. But we have already secured a facility that has a commercially available test. It is called Rapid, my honorable and learned friend, but Rapid means 2 days. And we will be having it in Bermuda, and we're sourcing it as well as the equipment that's needed, because I want colleagues to also understand there is equipment needs to do the testing and to do the analysis and to do the extraction. So it is a process. So you have the test kit, and then you have the equipment that supports it. So it is a process. We've been exploring that for 10 days now. We have secured a particular we're in the process of finalizing that. But I just need everyone to know that the science has to also catch up, because what we do not want is to get a test kit that has not been validated, that has not been approved by the FDA or the PAHO, Public Health Organization, or the World Health Organization, because that would be a disaster. If we get a test that's not validated and the person it says that the person has COVID-19 and they stayed home for 2 weeks and they did not have it, we can appreciate the potential economic downfall. Likewise, if we get a test that's not been validated and it says negative and they're positive, it goes back to the honorable member from 32, 31, concern with respect to the spread. So we have to make sure that what we get is FDA approved, World Health Organization approved by PAHO, internationally accepted, that will be able to have a valid result.
Thank you. Supplementary?
Yes, Mr. Speaker.
Yes.
The minister mentioned about the fact that we have people that have been involved in this, and this isn't the first rodeo. And then that just reminded me that in the past, especially with SARS, one of the things that we were able to do, which the minister in Barbados said that reminded me, that we have a system which allows us to know where people have been, so that if people have been in areas where perhaps we have some concern, you could go, the government can go and see where they've been, and then not just rely on them to say, well, I haven't been in any area that's suspect, but the government could actually see that through the airline system, whether they have been. So have we done anything to put that into place? Because I know that it was something that Bermuda had when we're dealing with SARS.
Minister?
I can't answer that, Mr. Speaker. I'll have to confirm with the team, because I don't know that there's any type of system. We do have, when the ships come in, we have the certificate from Port Health that will indicate where their passengers have come in before they arrive to Bermuda. I also know that the United States also provides us information for passengers that are traveling through the United States as to where that person came from. But insofar as from other jurisdictions, I'd have to get that information and revert to the honorable member.
Thank you. Your third question?
Second question. The other one was a supplementary, and I'm
Okay.
only entitled to two, I believe. But
Yeah.
and this is my final question.
All right.
I thank the honorable and learned health minister. I think it really is useful to hear from you and for this to be shared with Parliament, because it is our opportunity to share this further with the public. And the more the public knows, the less there is a risk of unnecessary fear. You very helpfully identified steps being put in place by the government to streamline the arrival of hand sanitizers and masks, and you identified duty relief. Presumably that duty relief bill will be brought to Parliament and supported by both parties as soon as possible. Do you have a time frame on that?
Minister?
On the order is probably all that's necessary for duty relief, but
Mr. Speaker, I don't have a time frame. We're actually today. Look at that. The Minister of Finance has just indicated that the order is coming today. So thank you.
thank you, Mr. Speaker. Grateful.
No further questions from the member from 22. The next member who's indicated to have questions is a member from constituency 31. Would you like to still put your questions?
Yes, thank you, Mr. Speaker.
Go right ahead.
Once again, we obviously are not trying to get fear with this. We're just trying to get information because the population is feeling anxious, mainly because the international news is showing quite a different outlook than where we are presently in Bermuda. So my question is around, we've seen some major changes in how people are dealing with large gatherings. So in particular, sporting events. In some jurisdictions, you're seeing where there's not going to be fans in the stands. There's some changes in how people are dealing with locker rooms. My question is, when we are dealing with major events coming to Bermuda shortly, Carifta Games and the triathlon, we also have teams that will be leaving Bermuda and going to other jurisdictions. There is a couple of teams recently that have decided not to come to Bermuda because of issues with COVID-19 from where they're coming from. Can the minister give any information on how the health department, along with youth and sport, is dealing with the potential of changes to sporting events locally and teams traveling overseas?
Thank you. Minister?
Thank you, Mr. Speaker. Mr. Speaker, again, as it relates to the information that we have within the ministry, which is coming from the World Health Organization, Pan American Health Organization, as well as CDC. So those are our international bodies. And what we're doing is monitoring, thank you, we're monitoring the information that they are providing to us. And as it relates to certain jurisdictions, we have issued travel advisories to persons not to go to those particular jurisdictions, whether or not it's for a sporting event or visiting, et cetera, et cetera. The PERT team, the public health PERT team in Bermuda also is working hand in hand with the EMO, and there's the disaster risk reduction mitigation team. And I can't call the gentleman's name right now who is actually in charge of an aspect of that team, a subgroup that Lyndon Rayner, that are tasked with working with organizations such as sporting clubs and so forth to make accurate information about the position that Bermuda is in, which again is ranked low, rated low, as to whether or not they wish to continue with respect to the sporting group. So that particular group has been tasked with liaising with sporting groups and organizations as to whether or not they wish to continue. I couldn't stand here and correctly say that it's business as usual, because we recognize that we are in a very challenging time right now. The government is committed to doing what we can to address this issue. However, we do recognize that there will be an economic impact, and there will likely be events that are going to be canceled, and persons will choose for a number of reasons not to participate in that particular event. However, at this point, the government has not made any decisions, as to whether or not they plan on imposing travel restrictions coming into Bermuda from various passages, or alternatively, whether or not we wish to cancel any type of public gatherings, sporting events, and so forth. Those are discussions that we are having ongoing. The FERT team meets very regularly. In fact, part of the team, the medical part, a medical group met this morning, and I was briefed, and those are discussions that we will be taking to cabinet next week as to whether or not we wish to go ahead and start considering canceling certain types of public events.
Thank you, Minister. Do you have any further questions? No further questions? The Officer Whip is the last member who indicated that she would like to put some questions to you, Minister.
Thank you,
Madam
Mr.
Whip?
Speaker. Thank you. My question is around unexpected diversions to the island. So if an airplane is diverted to Bermuda because someone who may have had some symptoms before the flight and then got on the flight and the fever came back and was escalating, what is the procedure for an unexpected flight that could divert to Bermuda with someone who has symptoms that could be reflective of the COVID-19? And I'll just ask that.
Minister.
Thank you. Thank the honorable member for that question. That is a scenario that has been discussed heavily in the FERT team. And what is expected and anticipated is that, well, first let me back up, because our airline partners now, obviously we can't control what they do on the outside in other jurisdictions, but our airline partners are actually starting to question individuals before they get on the plane, and making the same questions that customs are asking upon arrival in Bermuda. They're also asking passengers as they get ready to book the plane, making observations about illnesses and so forth, because they certainly don't want that passenger obviously traveling as well. However, in the circumstances like the honorable member just mentioned, what would happen is that the first responders would attend at the runway. That passenger would be removed from the plane, treated and or taken to the hospital, depending on their circumstances, and then the plane would continue on. The rest of the patients would unlikely be, they would continue on to their next stop. They would, beg your pardon? Patients, sorry. The patients, the rest of the passengers, the other passengers would continue on. It's similar to when they have a divergence now where there's a person that has a heart condition. They stop, the medical responders are there, they take them off the plane to address whatever, and then the plane continues on.
Thank you. Supplementary? Supplementary, yes?
Yes, thank you. So my supplementary question would be, do we have the equipment for the professionals, the first responders that would provide the protective gear needed should they have to face an unexpected emergency such as this?
Thank you, Mr. Speaker. It's called PPEs, personal protective equipment. And we do have quite a supply on island. Admittingly though, Mr. Speaker, the N95 mask has to be fitted. They have to test fit them. And the size medium is almost like a size 7 shoe. It's quite popular worldwide. Size 7 for women. It's popular worldwide. So we are trying to secure those. The first responders have PPEs. The nursing staff, community health have PPEs, but we're ordering more in order to ensure that we have full supply. That has already been sourced from a supplier here. He's already procured it. We're getting ready to we're looking for a location so that all of the PPEs and all of the things that we need, hand sanitizers and the like, is at one location so that people can go and access it accordingly. However, as I said, the size N95 medium is in short supply, but we are doing our best to source it from other jurisdictions. Just as on an aside, there's the company that makes them is called 3M. And in order for them to it's a U.S. company, they make them in the United, well, I don't know if they make them in the United States, but it's a U.S. company. In order to export them out, they have to have permission. So they're kind of holding on to their things too. So it is a worldwide phenomenon. One of the companies that we're looking at is in Far East, but the procurement, I have somebody Ministry of Health has somebody that's dealing with all of the procurement of those particular items, but certainly our first responders and our health personnel have those PPE sets.
Thank you. Thank you, Minister. No further questions? Oh, yes.
I'd like to ask the minister if the Lam Fogo Clinic has ever been considered as a site in the event that we need to quarantine or for acute cases. I wouldn't know necessarily what the source of the use would be, but whether that has been considered as an off-site location.
Minister?
Mr. Speaker, I thank the honorable member for that question. Certainly, the Lam Fogo site is a medical facility, so we would not consider that to be an appropriate site for the quarantine. However, in circumstances, if we obviously require more medical attention for local residents, then that would obviously be a facility that would be continually used for that purpose, but certainly not for a quarantine.
Thank you. No further questions? It brings us to a close of the question and answer period, and we can move on.
Congratulatory and/or obituary speech.
Would any member like to add a condolences or congratulatory remark? There are none.
Personal explanation.
There are none.
Notice of motions for the adjournment of the House on matters of urgent public importance.
There are none.
Introduction of bills.
There's one bill this morning, named the Minister of Finance. Minister?
Mr. Speaker, I am introducing the following bill, which according to section 36(3) of the Bermuda